when it comes to adults, what are your diagnostic criteria, first of all, for distinguishing something which you think is genuinely influenza as opposed to a cold of varying degrees of severity? And is there a point at which you would feel the need to require a hospital test for an adult, or even to send that adult to hospital?
Yeah, so I think there are three different things that we need to distinguish. One, first of all, is how sick is the patient? And for us, that is the differential between just a cold and full-blown influenza. There are loads of people who will have snotty noses, who will have some sinus symptoms, who will maybe get a bit of a mild headache and a slight temperature up and down a bit, but just generally feel a bit off. But that's not flu.
Yeah, right, yes.
In flu, you've really got a full package of significantly high temperature, really severe malaise, myalgia, feeling really achy and cold through the body, the swinging pyrexia. You've got people with severe headaches, glands up, everything. But actually, when you examine them, you don't find any clinical signs of a bacterial infection. And the thing you're particularly looking to rule out is a pneumonia.
Right.
So when you tap on their chest and when you listen to their chest, it's beautifully clear. There's no bubbling, there's no crepitations, there's generally not even any wheeze there. They just feel absolutely dreadful.
Right.
And I think there is just a degree in the symptoms for us that is the differential between common cold, full-blown influenza. Yeah. And then it's to do with how much that person can cope with and how severe their symptoms are, and maybe what else they've got going on with them, as to whether or not we would ever go for a swab or ask for a definite diagnosis of influenza from the hospital. To be honest, probably in the last 2 years, I haven't asked for one.
Right. Yes.
I've seen plenty of people with influenza, but have I felt the need to actually get an official diagnosis? Actually, the clinical diagnosis has been sufficient. And with some good communication with the patient and them understanding what's going on and how long those symptoms are likely to last for and what they should do and what they should look out for, the vast majority of times we can manage that without any need for further investigation.